I chose UM-Dearborn to continue my education because not a lot of schools offered a clinical health psychology program. And I've always had an intense interest in the human mind and how people work and why they behave the way they do.
The clinical program, individuals are trained in the basics of clinical psychology, so they get pretty sound foundation in psychopathology and diagnosis. They get thorough training on psychotherapy, both in individual settings and with more than one person in the therapy room.
For my research, I was on Dr. David Chakoff's and Dr. Michelle Leonard's research team. Right now, I'm conducting my thesis on stress and cardiovascular disease in women. So what we're doing is we're looking at how emotional expression, emotional regulation, and ambivalence over emotional expression is related to the cardiovascular health.
I think a lot of graduate school really is kind of defined by what goes on outside of the classroom. Like within the classroom setting in graduate school, I found it much more engaging than in an undergraduate environment because the classes are not didactic necessarily in nature, they're more experiential, and the students get to have more of a chance to interact in a teaching role and also in a role where we're all sharing and learning from each other.
This program takes a lot of time and a lot of effort to put in. So not only do the students have to write papers and do homework, but in clinical health psychology, you need to learn therapeutic skills. You need to learn about empathy and building rapport and working with clients directly. Dr. Michelle Leonard also has great connections throughout the community. She was one of the ones responsible for giving us students practicum sites. I have mine at Henry Ford Hospital, and right now I'm working with bariatric patients doing their psychological evaluations. So they'll come in to get clearance to go through with the bariatric surgery. I'm also working with liver transplant patients and their families. So the day they get the phone call saying, you've received a liver, they know their exact plan. They know what to do and what steps to take.
I look for students who are hungry to learn, who are willing to put in the time and have the motivation to really work to become both competent in what they're doing and confident in what they're doing.